You're watching the Microsoft US Health and Life Sciences Confessions of Health Geeks podcast, a show that offers industry insight from the health geeks and data freaks of the US Health and Life Sciences industry team. I'm your host, Claire Bonacy. Today we continue our health plan series with Sam Robinson, our National Director for US Health Plans. Sam recently spoke at the International Federation of Health Plans COVID-19 series, and on this episode, we discuss how health plans can be more proactive in adapting to this new normal. Hi, Sam. Welcome to episode 2 of the Health Plan series.
Hi, Claire. Thanks for having me back.
Yeah, of course. So 2 weeks ago, you spoke at the International Federation of Health Plans COVID-19 series, and I'd love to learn a little bit more about that. Can you tell us what your key message was and what attendees were most interested in?
Sure. It was a fantastic conference, obviously held virtually over Teams. So I was very pleased by that. And we had A to Z. I can't think of who the A health plan was, but all the way through Zimbabwe. So Chile, Zimbabwe, South Africa, New Zealand. And what the common theme was across all of these health plans are, what are we going to do? How do we stay in business? Are we going to stay in business? So if you're a CEO of a health plan right now, your board is saying, what are you doing? And what are you doing? The right answer is not nothing or the same or hoping things turn out. So the major theme and question for most of them is, what should we be focused on from a digitization standpoint to lead us into the future and frankly to survive the current? That really brought us down to the framework that I think you've heard a lot from Satya on down about. Responding to the crisis is the first stage. We are now in a recover phase, if you will, with some, and some are still in respond. But then you will move into a reimagine phase, which won't be optional. You'll either reimagine your business or you won't have a business. And as we talked to the health plans, what they were really focused on, or what we focused my message on, was you need to respond. But that response should have at its heart a reimagine end to it. So start with the end in mind. And the end is a reimagine. So there's a lot of efforts that are going on right now in health plans before COVID, if you remember back that far, that really led to where they are now. And those same efforts, especially the digitization efforts, are, if anything, accelerated because of the crisis, and that's a good thing. And it will allow them to move to where they had to be anyway, is a reimagined state of business where virtual is not a part of what they do. It's not an alternative to an in-person. It is a core part of every business line that they need to recover from.
It's a really great answer. I love that you bring up that a lot of these health plans were already doing efforts with virtual health, and they were already kind of doing that to begin with, but now it's really reimagining that new normal. So can you give us some examples of how virtual health would be affected by the changes that these health plans are making?
Sure. For years, we've heard about a focus on the member. Member first, member 360, total health of the member, moving from a payment to a care navigator. All these things are the same general theme is we care about our members and we want to service our members in a new and unique way. All of those efforts started pre-COVID, and virtual health being one of them. What was virtual health? Really just a different service they were paying for. In COVID, we're now paying the same. So in person, we call that parity. We're paying parity. That's a real respond reaction. Hey, we'll still pay for it, do it your way. What the health plans that are looking to the future are saying is, how do we make virtual health a real part of our care management plans? How do we use virtual health as part of how we go to market? So imagine an oncology case. You might have 20 visits in a given treatment cycle to the oncologist, not to treatment points of treatment, but to the oncologist. Can some of those be virtual? Absolutely. But does that virtual mean the same as a in-person visit? Absolutely not. It has to be optimized for the virtual experience. Maybe a pre-survey, a post-survey of whether it happened. Maybe the pre-survey asks, are you feeling? How are you dealing with the therapies? Are there anything we could do for you? Do you have any major questions you want us to answer? That's reviewed by the doctor while you're in the waiting room, the electronic waiting room. And when you go in, it's a much more meaningful conversation, much like we're having right now. And that's part of your overall plan. And guess what? The parity will go away. I'm not going to pay the same for that 5-minute conversation that I would for an inpatient visit where I'm using resources and office time, et cetera. There's a lot of negotiation. And what we're seeing is when you bake virtual care into a value-based plan, it can be very powerful, most importantly, as an effective treatment plan, but secondarily for the consumer who can sit here in our homes just like we are now to do that appointment. And lastly, whether they like it or not, for the providers. Right now, fee-for-service has left them high and dry. There's a lot of providers going out of business waiting for patients to walk in their door or trying to supplement with the virtual health that they can. A value-based payment program paying, for example, a bundled payment for an oncology treatment will keep them in business longer and is frankly a much more sustainable model for our economy and to keep the providers there that we need when we need them.
So one area I'm interested in as well is behavioral health. So how is that really being affected right now?
Very great question. We've always suffered from our having a decent, behavioral health network. While there's Magellans and others out there that are, outsourcing that, the individual health plans have always wanted to get more control over a mental health network, run a mental health network, and frankly, bake it into like the oncology care plan we just talked about. We all know the evidence is there. If we add behavioral health screening, if we add behavioral health visits into a care plan, we're going to get better outcomes. It's just that simple. And it's a very cost-effective way to get best outcomes. The issue is if you're sick, if you're going through treatment, you don't really feel like dragging yourself into an office. If we can move that to a tele mental health visit, we really can expand not only what's happening out there in the world of mental health, which is underserved, but we can also get better outcomes and better member satisfaction. The trick, it's very state specific right now. And so you have to build up those networks. But I think this is the time that now that you have this behavioral health possibility in front of you, you're going to see plans invest a lot in building up their own mental health networks, working with the mental health plan providers, and building that into those virtual health visits into many, many more. And of course, we'll have to legislate to get that mental health cross-state, just like we did with the relaxed rules on regular visits and primary visits. We need to do the same thing on telehealth.
That's great. I'm really looking forward to that change, actually. So if you had to choose one other area health plan should focus on right now to be more proactive, what would it be?
Sure. The general area that I would say you should focus on is everything. Anywhere you're dropping to paper, anything that's not digitized. But specifically, think about what's coming up. We have open enrollment coming up. My open enrollment is around the corner. If you don't have a way to do that virtually, you're really going to drop your memberships. Let's take one population, the Medicare Advantage population. Typically, I will do phone trees. I will do lots of ways to get to those folks. I also probably drive an RV up and just park it and say, come on in. That's not going to happen. Or I go to a local community center and have a mass meeting. That's not going to happen on many fronts, right? So how do you take that meeting concept, bring people in, and make the virtual experience not only as good as an in-person experience, but better? How do you deal with the technology limitations of that population and still allow them to have a differentiated experience? If you focus there, like everything we've talked about within the member, then you're going to have a much better outcome and you'll get to that reimagine stage much faster.
So really just being proactive, reimagining the new normal from every stage of virtual and every stage of the patient engagement. So that's great. Thanks so much, Sam. This has been insightful, and I'm really looking forward to episode 3 of the Health Plan series next month.
Thank you, Claire. Good speaking to you again.
Thank you all for watching. We look forward to having Sam back next month. Please feel free to leave us questions or comments below, and check back soon for more content from the HLS industry team.